So I'd like to introduce Rebecca McIntosh from Carrington Health. Rebecca will be talking to us about a model of cancer survivorship care within a community health setting, the Good Life Cancer Survivorship Program. Thanks.
Thank you. So the model of cancer survivorship care within a community health setting, I'm pleased to present today on the Carrington Health Good Life Cancer Survivorship Program. I'd firstly just like to acknowledge that today's presentation is actually a component of a much larger project that we received support from the Victorian government to work on. Integrating services cannot occur without effective partnerships, as we've heard throughout the day today, and these were definitely strengthened by our project team and the project steering committee membership who helped to support implementation of this model of care. Cancer survival rates are improving due to advances in treatment and earlier detection. 60% of cancers occur in persons greater than 65 years of age, and frail older cancer survivors tend to have poorer outcomes and are an underserviced group. Cancer survivors require ongoing support to self-manage their health and optimise quality of life, and this is supported by the Clinical Oncology Society of Australia's model of survivorship care. Coordinated, integrated access to allied health professionals and self-management support interventions underpin survivorship care. From the literature, we know allied health interventions in this cohort improve quality of life, physical fitness, wellbeing, mental health, communication, mobility, function, nutritional status, and reduce fatigue and pain in cancer survivors. Frail older cancer survivors and those who require ongoing treatment require access to more flexible, coordinated and slower stream allied health support. Another model of care is required to complement the intensive short-term oncology rehab program approach. Carrington Health recognised the key role that existing community health services can play in bridging this gap. With experience and expertise in the delivery of chronic disease management programs, Carrington Health was well placed to bring together acute, subacute cancer interventions with ongoing community-based support, best suited to survivorship care. Effective care coordination between oncology settings and community health could support survivor transition to allied health services and empower them to self-manage their health and their wellbeing. So today I will report on evaluation of a referral pathway from a hospital-based acute oncology service, Eastern Health, which is located in the eastern suburbs of Melbourne, to a multidisciplinary community-based health service, Carrington Health, which is located in Box Hill, the eastern suburbs of Melbourne. So the aims were to understand patterns of allied health service utilisation at Carrington Health and to understand health professionals' perspectives on the implementation of a community-based model of survivorship care. However, this was part of a larger project that was undertaken to build the capacity of the community health workforce to implement a community-based survivorship model of care. Evaluation was conducted by a team from the School of Midwifery and Nursing in the Faculty of Health at Deakin University. And the evaluation framework was designed in consultation with the Carrington Health project team and with reference to the Victorian Cancer Survivorship Program Evaluation Outcomes Framework. Two main components comprised the program evaluation. Service utilisation data was analysed to identify patterns of health service utilisation for Carrington Health survivors referred to the program. Semi-structured interviews with health professionals involved in the program were also undertaken to elicit views on the feasibility of the program, the suitability of the target group, health professionals' confidence in delivering the program, and whether further training or support was required. Interviews were recorded and transcribed verbatim and subjected to qualitative descriptive analysis. The Good Life Cancer Survivorship Program accepted referrals only from Eastern Health acute oncology services. GPs and other primary healthcare providers were outside the scope of this project. The program was targeted at frail, older cancer survivors unable to participate in intensive ambulatory oncology rehab programs. Survivors referred were undergoing or had completed cancer treatment. They needed to be ready and able to participate in self-management. And so in discussions with our partners, we sort of tried to define what we meant by ready and able to participate. We obviously wanted survivors that were not acutely unwell, that were in a good position to be able to engage with the community health service. So the patients that sort of tended to represent then were patients that had completed curative intent cancer treatment, patients with metastatic hormone-sensitive prostate cancer, and patients receiving immunotherapy. Referrals made to Carrington Health and the Carrington Health service utilisation data was captured over a 5-month period, keeping in mind this was part of a bigger project that ran for 12 months and there was an ethics component to it. Unfortunately, it limited our pilot period to the 5 months. A total of 25 referrals were made from Eastern Health, and as you can see there, that was predominantly from oncology nurses, although nearly a third were from medical staff. The recruitment period was over, as you can see there, sort of December, January periods, which obviously not ideal timing. And we also sort of learnt that specialty medicine staff routinely rotate at the start of the year as well. So while there was really good referral uptake at the start, this did drop away a little bit, unfortunately, in January and February, as you can see. But we did have some really good change champions in the oncology nurses at Eastern Health, but there were a few changes to those roles at the end of March as well, which we think could have impacted a little bit on our referral numbers also. So this slide here just shows some of the demographic and clinical characteristics of the clients referred to the Good Life Cancer Survivorship program. The mean age of the cohort was 66 years and 58% were male. The tumour types represented, a third of referrals were from lung, followed by colorectal and genitourinary, and these represented our intended key target cohort as well. Around half the clients referred had been diagnosed with cancer within the previous 12 months and were most likely to have had late-stage disease. The majority of clients referred had received one treatment, and the most common overall was chemotherapy. However, in terms of the treatment options received, this did vary quite widely. And the majority of the clients referred had completed treatment in the past month. So this just takes you a little bit through the story of the referrals then that we received. So of the 25 referrals, you'll see there that 21 were eligible, and of that, a further 18 went on to have an appointment booked. Survivors accessed multiple services at Carrington Health, but the most accessed service was physiotherapy, followed by psychology and dietitian appointments. Of those eligible who were accepted to the program, 2/3 received 3 appointments and a third received up to 7 appointments from either a nursing or allied health professional during that 5-month pilot period. Over half of the received referrals had identified need for one discipline, 20% had identified need for 2 disciplines, and around a quarter identified need for 3. However, many patients referred remained active within the service on the final date of data collection, keeping in mind it was a short 5-month pilot, indicating that this is obviously likely an underestimation of true service utilisation, given full episodes of care have not yet been completed. And from the health professional viewpoint, we surveyed 9 health professionals during May, so 6 professionals from Carrington Health that were involved in delivery of the Good Life Cancer Survivorship program. And you can see there from the slide they were dietitians, physiotherapists and community health nurses that had all worked for between 9 months and 22 years at the service. We also had 3 Eastern Health professionals interviewed as well. If you recall, these were our main referrers to the program. So these included a wellness coordinator in cancer services, a prostate cancer specialist nurse, and 1 lung cancer nurse coordinator. And they had all worked at Eastern Health for between 12 to 16 months. The majority of Carrington Health professionals were confident in selecting and performing appropriate assessments, knowing what general services or supports were available for the patient, finding information about best practice clinical interventions, and accessing reliable and high quality information and resources for the client. However, the majority indicated less confidence, knowing what cancer-specific services or supports were available and understanding the individual's cancer journey so far. Eastern Health professionals were familiar with the Good Life Cancer Survivorship program, reported being very confident in referring their patients to the service and had done so in the last 6 months. The referral and triage processes were reported to be very simple and straightforward. 4 main themes emerged from the interviews with both health professional groups. Firstly, that allied health services are highly relevant to people with cancer. Diverse cohorts that would benefit from Good Life Cancer Survivorship were identified, and these diverse cohorts of survivors that would benefit were identified as those that were coping with treatment side effects, those that were diagnosed with slow-growing cancers or localised tumours or metastasised tumours, those undergoing treatment such as immunotherapy or in a post-treatment phase that were learning to adopt a healthy lifestyle, and finally those interested in maintaining general wellbeing. The second theme identified was around education and information needs. So there was consensus that further education and information would improve quality care provision. Thirdly, communication gaps. There's a need to foster communication between acute care settings, community health and cancer survivors, and this was emphasised. And the final identified theme, a one-stop, multidisciplinary and holistic care model. Advantages to survivors in receiving allied health care through community health settings was discussed. And finally, our key learnings. The Good Life Cancer Survivorship program provides a model to support integrated allied healthcare services to help survivors transition from acute treatment to a community-based care and integrated into an existing chronic disease management program at Carrington Health. Good Life Cancer Survivorship is acceptable to clinicians and referrers and has provided relevant and needed allied healthcare services for a range of underserved cancer survivors in the Eastern Metropolitan region. Supporting ongoing awareness, education and understanding of services across community and acute care settings will foster care coordination and strengthen referral pathways. Clinicians within the community health setting are interested in continuing to increase their knowledge and skills and to build greater confidence in treating and supporting cancer survivors. Hospital-based clinicians acknowledge the need to properly communicate Carrington Health services to cancer survivors and to understand the types of services available in community health settings to help survivors normalise their cancer experience. There is a need to continue to improve communication between acute care settings and community health and cancer survivors. Central points of contact for coordinating referrals and communicating medical information between acute care settings and community health settings are important to help address communication gaps and strengthen this model of care. And finally, community health is a valid setting to support cancer survivors. Core components of the Carrington Health Good Life Cancer Survivorship program could be implemented across other community health services to improve access to allied health services for all cancer survivors. Thank you.
Does anyone have any questions for Rebecca?